you ever been, in a conversation or maybe just looking at some technical report? You get that feeling.
Oh, yeah, like you're suddenly lost?
Exactly. Lost in just a sea of jargon. And it happens a lot in the medical field, right? Those really long, complex words.
Mm-hmm.
They can instantly make you feel like you're, I don't know, trying to read some ancient language.
It's definitely a common thing, and honestly, the amount of information, it can be genuinely overwhelming.
But what if I told you that mastering this seemingly impossible language isn't really about memorizing thousands of words?
Okay.
It's more about understanding a system, a surprisingly elegant system underneath it all.
Right, like finding the key.
Precisely. And today, in this deep dive, we're basically giving you that key, a shortcut. Our goal, our mission, is to help you quickly understand, interpret, maybe even deduce the meaning of these complex medical terms.
Turning that confusion into an aha moment.
Yes, those aha moments. We're going to show you how this specific detailed glossary we're looking at, the Fundamental Nursing Vocabulary Prefix Word Root Suffix Glossary, really gives you a roadmap.
Taking something dense like a textbook chapter and making it, well, an engaging exploration.
Exactly.
Yeah.
So how do we even start? How do we untangle this medical language?
Well, it really starts with seeing the basic structure.
Like linguistic Legos, I was thinking.
That's a great way to put it, yeah. Every complex medical word, it's typically built from 3 core bits: a word root, a prefix, and a suffix.
Okay, 3 parts.
3 parts. The word root, that's your foundation. The main subject, the core meaning.
Right.
And often, just to make it flow better when you say it, the root gets a connecting vowel that makes what the glossary calls a combining form.
Ah, okay, like steth becomes stetho.
Exactly like that. Then you've got the prefix that comes before the root.
And it modifies it somehow.
Totally. It acts as an immediate modifier. It gives you clues about direction, quantity, maybe negation.
Got it. And the third part.
That's the suffix, the word ending. It follows the root and refines the meaning, describes a condition, a procedure, maybe a quality.
Prefix, root, suffix.
Okay. And what's really amazing, I think, is how precisely these pieces fit together to paint a full picture. Take a stethoscope.
Okay.
Our source material breaks this down really nicely. You have steth, that's the root for chest,
Right.
combined with the suffix scope, meaning an instrument used to look in or examine a body part.
Ah, so put them together.
And a stethoscope becomes, logically, an examining instrument used to convey sounds from the patient's body to the examiner's ear. The meaning just clicks.
It really does. That's clear.
Or how about thrombocyte?
Okay, thrombocyte.
Here, throm is the root. It means blood clot.
Blood clot. Got it.
And allocyte is the suffix for cell.
So a clot cell.
Pretty much. It's defined precisely as a blood platelet, a cell fragment that participates in blood clotting.
Makes sense.
One more quick one from the glossary. Monochrome. Mono is the prefix. Means single or one.
Mono. 1. Like monorail.
Exactly. And chroma is the root for color.
So single color.
Yep. Of one color, of the same color. Simple when you see the parts.
That is incredibly clear. But what about words that seem even more complex? Like, are there terms made of more than just these 3 parts? Compound words.
Oh, absolutely. That's a great question. The glossary definitely points out that many medical terms are indeed compound words.
Yeah.
They're made up of more than one word root, or maybe more than one combining form.
Can you give an example?
Sure. Think of sternoclavicular.
Sternoclavicular. Okay, I hear sterno like sternum and clavicular like clavicle.
You got it, involving the sternum and clavicle. Or another one is erythrocyte.
Erythrocyte. Red blood cell.
Exactly.
Okay.
Red blood cell. It shows how these blocks can stack up. But the real power here, for you listening, is knowing these core pieces.
The root, prefix, suffix.
Yes. It unlocks this, systematic way to decode words that seem really complex without having to memorize every single one.
It's like learning the grammar rules instead of just vocabulary lists.
Perfect analogy.
Okay, so diving into this glossary, what really jumped out at me was the prefixes.
Yes.
They're just these tiny bits at the start of a word, but wow, they pack so much information. They kind of set the scene immediately, don't they? Clues for direction, quantity, quality.
They really are like immediate signposts. It's fascinating. Consider prefixes that show opposites and directions.
Okay.
Like A or A. That means absent, deficient, lack of.
So like in AV, a lack of speech.
Precisely. Or anaerobic, without oxygen. Then you've got A, meaning away from.
Like adduct, to move away from the midline.
Exactly. And the direct opposite is ad, meaning toward or added to.
Like adduction, moving toward the midline.
Perfect. See, the prefix tells you the direction instantly.
And those subtle differences are so crucial for being precise, like inter versus intra.
Oh, that's a key pair. Inter means between, so intercellular is between cells. But intra means within a part or structure. So intracellular is specifically within the cell. Big difference.
Huge difference. And for location, I saw retro.
Yes, retro means backward or located behind. It instantly tells you retroperitoneal means behind the peritoneal cavity. Very useful.
Definitely. What about quantity and size?
Prefixes are great for that too. Very effective. Bi obviously means two or twice, like biannual.
Okay.
Poly means many. As in polyarthritis, that refers to arthritic symptoms in several joints.
Poly, many, got it.
Then you have the size comparisons. Macro means large in size.
Micro, big.
Right. And its opposite, micro, means very small, as in microsurgery.
Makes sense.
And for things that are unusually large, you might see mega, megalo, or even the suffix megaly. They all point to unusually or excessively large.
Oh, like splenomegaly.
Exactly. An enlarged spleen. The prefix or related suffix tells you right away.
So beyond direction and quantity, prefixes can signal quality or state too, right?
They absolutely can. Dis is a really common one you'll see.
That sounds negative.
It usually indicates something difficult or painful. Think dysphagia.
Difficulty swallowing.
You got it. Or dysmenorrhea, painful menstruation.
Okay. What's the opposite of dis? Is there a good prefix?
There is. Eu, it means, well, normal or good.
You up.
So euponia is normal breathing, and euphoria, that's a good emotional state.
You for good, dis for difficult, painful. That's a helpful pair.
Now, this leads us to something really important, a potential aha moment, but also a bit of a warning about being precise.
Okay.
Let's take hyper S. Typically, it means above, over, or excessive, like hypertension, high blood pressure. Makes sense.
Yeah, hyper means high or too much.
Usually. But here's where our specific glossary throws a curveball. It gives the example hyperglycemia.
Okay, high blood sugar, right?
Right.
Hyperglycemia, high sugar in the blood.
That's what you'd expect. But listen to the definition from this specific source we're using. It defines hyperglycemia as deficient glucose in the blood.
Wait, deficient? That sounds like low blood sugar. That sounds like hypoglycemia.
Exactly. Now, we're reporting exactly what the source says here. This isn't necessarily the standard definition you'll find everywhere, but it's what this glossary states.
Wow, okay.
And that's a crucial takeaway. It's not just a typo. It's a powerful reminder that while these prefixes and parts give you strong clues, you always need to check the definition in a reliable context, like this glossary.
So the parts help you decode, but the specific source confirms the precise meaning, which might even be counterintuitive sometimes.
Precisely. The real insight isn't just decoding, it's understanding the nuances, sometimes the very specific nuances a particular source provides, that avoids potentially critical mix-ups.
That's a really important point. Context is everything.
Absolutely. So if we connect this to the bigger picture, recognizing these patterns, even with these specific glossary definitions, helps you anticipate meaning, but always with that check for precision. It fosters a more informed way of learning.
That makes total sense. Okay, let's move on to the heart of the word then. The word roots.
Yes, the core meaning.
These really give you the main subject, right?
Mm-hmm.
Often linked to body parts, functions, characteristics. They tell you the fundamental what.
Exactly. Let's dive into some key roots, maybe groups them a bit. How about body systems and parts first?
Sounds good.
Okay, hema, hemo, or hemato. You see that, you think blood.
Right, like hematuria.
Which means blood in the urine. Perfect. Then there's hepato. That signifies the liver.
Leading to hepatitis. Inflammation of the liver.
You've got it. If you see myo, think muscle.
Like in myocardium, the heart muscle.
The muscular layer of the heart, exactly. Neph, or nephro, clearly points to the kidney.
So nephrectomy would be removal of the kidney.
Surgical removal of the kidney, yes. For the nose, the root is rhino.
Ah, like rhinitis. Inflammation of the nasal cavity.
Mm-hmm. And we already mentioned stetho for chest in stethoscope.
Oh, we did.
And another important one, meningo. That refers to the membranes covering the brain and spinal cord.
Which gives us meningitis, inflammation of those membranes.
Precisely. So those roots point right to the body part.
Okay, what about roots, describing conditions or characteristics?
Good category. Hydro is about water.
So to hydrate is to supply with water. Simple enough.
Yep. Leuco means white or colorless.
Like leukocyte, a white blood cell.
Exactly. On the flip side, melano means dark or black in color.
Which unfortunately leads to melanoma, that dark-skinned tumor.
A tumor on the skin that is very dark or black is the definition here. Then there's sep or septic. That relates to poison, rot, or decay.
Giving us septicemia. That sounds serious.
It is. Bacterial infection of the blood, and if something is narrowed, the root might be steno.
Steno. Narrowed, like coronary artery stenosis.
Perfect example. Narrowing of a coronary arterial blood vessel.
Okay, so body parts, conditions, any other types of roots?
Yeah, let's cover a few linked to actions or concepts. Pyro. That means fever or fire.
So an antipyretic drug would fight fever.
An agent with fever-reducing properties.
Yeah.
Exactly. Then there's ish. That implies suppression.
Ish. Suppression, like an ischemia.
Right. Which means suppressed blood flow. Very important term.
Yeah.
And stat or stasis indicates stoppage.
Like hemostasis. Stopping bleeding.
Stoppage of blood flow. Yes. So you see how recognizing these roots really gives you the what of the term. It lays that foundation.
It really does. Okay, so we've got prefixes setting the scene, roots giving the core subject that leaves the suffixes, the endings.
Right. Rounding out the architecture, as you said.
And these endings, they refine the meaning, right? They describe the condition or the procedure or the quality. They tell you what's happening or what it is.
Exactly. They add that final layer of specificity. Let's look at some key ones, starting with suffixes for medical procedures and conditions.
Okay.
Appendectomy is probably one many people know. It means surgical removal.
Like appendectomy, removal of the appendix.
Correct. And if you see enneitis, that consistently means inflammation.
Like appendicitis,
Yeah.
inflammation of the appendix. The difference is just that ending.
It is. Aemma means tumor or swelling.
Like lipoma, a fatty tumor.
A fatty tumor, yes. Or hematoma, which the glossary defines as swelling due to an abnormal pooling collection of blood.
Got it. Oma is tumor or swelling.
And phimostomy refers to the surgical creation of an opening in a hollow organ.
Like a tracheostomy or a colostomy, creating an opening.
Precisely. Those endings tell you what kind of procedure or condition it is.
Okay, what about suffixes that describe states or indicators?
Good ones to know. For instance, emphysenemia refers to a condition of the blood.
Like in hyperglycemia again.
Exactly. And again, our source defines that example as deficient glucose in the blood, just reinforcing that context point.
Right, context is key. Okay, other states.
And chememia means lack of.
Pemia, lack of, like thrombocytopenia.
Yes, a decrease or lack of thrombocyte blood cells. Then there's plegia, which denotes paralysis.
Like quadriplegia, paralysis of all four limbs.
And iphthistosis means downward displacement or falling.
Ptosis, falling, like blepharoptosis, drooping eyelids.
Downward displacement of the eyelids. You're decoding these perfectly.
It's starting to click. What about actions and flow?
Lots of useful suffixes there. Aphagia or aphidagy relates to eating, swallowing.
So dysphagia is difficulty swallowing. We saw dysphagias earlier.
You did, putting it together. Now, related but different is phasia. That refers to speech, ability to talk.
So dysphagia is difficulty speaking, phagia is swallowing, phagia is speaking.
Correct. Subtleties matter. Sadia indicates air or breathing.
Like eupnea was normal breathing.
You are breathing less. If you see eulerage or ragia, think bursting forth, excessive flow.
Like hemorrhage, excessive blood flow.
Excessive flow, loss of blood. Yes, urea simply means flow or discharge.
Like rhinorrhea, runny nose.
Flow of secretions from the nose, exactly. Or diarrhea.
Oh, urine. That'd be urea, as in hematuria, blood in the urine.
Hematuria, blood, urine. Got it.
See how the suffix specifies the action or the substance involved?
Yeah, it really does. Are there suffixes for, like, tools or processes?
A few key ones, yes. Inogram means a record, that which is recorded. Like an electrogram, a recording of electrical activity.
Could be, yeah. And mescope, which we saw earlier.
Instrument to examine.
Instrument to examine or look into a part. Like a bronchoscope for looking into the bronchi.
Okay, this breakdown is fantastic, but I'm wondering, how do these suffixes really help distinguish between, say, a diagnosis versus a procedure or an outcome? Can you connect those dots?
That's a great question. It's precisely how these endings function. They provide the diagnosis, like a cherreitis for inflammation, or the specific action, like a cheriotomy for removal, or a cheriostomy for creating an opening.
Oh.
So when you connect a root, say hepate for liver, with a suffix like nesitis for inflammation.
You instantly get hepatitis,
Yeah.
the diagnosis.
Exactly. Or connect nephr for kidney with a cheriac.
Nephrectomy, the procedure. removal.
You've got it. It's like seeing that final puzzle piece, the suffix, and knowing exactly where it fits in the bigger clinical picture. It tells you the nature of the thing.
So combining all three prefix, root, suffix builds that complete understandable picture.
That's the whole idea. It gives you a structured way to approach these terms.
So as we kind of wrap up this deep dive, it really feels like we've uncovered well, a genuinely powerful framework here.
I think so too.
Instead of feeling intimidated by all that complex medical terminology, you listening now have this mental toolkit, right? A way to systematically break things down. And this whole approach, we think, goes way beyond just understanding medical jargon.
Oh, for sure. It's a way of thinking.
Exactly. It's a method of deconstruction. You could apply it to pretty much any specialized vocabulary or any complex information you run into.
Any system, really.
Yeah. So here's a final, maybe provocative thought for you. The next time you encounter one of those long, unfamiliar words, maybe medical, maybe something else entirely, don't just skip over it.
Don't assume it's impossible.
Right. Pause for a second. Consciously try to spot its parts. Is there a prefix? What's the core root? What's the suffix telling you?
See it as a puzzle.
Yes. See it as a puzzle to solve. And then think about how that whole approach, breaking things down, understanding the components, could apply elsewhere, beyond just language.
Understanding complex systems, problems, maybe even relationships.
Could be. It's all about fostering that habit of, critical thinking, lifelong discovery, just looking a little deeper.
Well said.
So go forth and decode.